everybody, I'm Dr. Kirthiga, a pediatric dentist, and I welcome all of you once again to ABCD. I'm so happy to meet all of you today. So if you had seen my previous videos, I would have told you that this channel is going to give you a lot of information about childhood decay. In the previous videos, we spoke about why childhood decay is important, and also who are the people who should be seeing all these videos. Today I'm going to tell you about what is exactly childhood decay, right? We've been hearing about childhood decay, we see about it in Google, but what is it exactly? So for us to know childhood decay, we need to understand a little bit about teeth, okay? So I'm going to go a little bit into theory. So the first tooth that comes into a baby can be as early as 6 months, or it can be as late as 12 months, or when the baby is turning 1 on the birthday, right? So the first tooth can come anywhere between 6 months to 12 months. And about when the child is about 2.5 3 years, all the baby teeth come, the total of 20 baby teeth that every child is going to have. And all these teeth take turns and they start falling and new teeth start coming until the age of 12. So after the age of 12, all the teeth that we are going to get, or the set that is there in a child, or probably a teenager at that point of time, is all permanent teeth. So before that, as I told you, any decay that comes in a baby teeth or in those 20 primary teeth is called as childhood decay. Alright, so let me explain it to you this way. Imagine that we have a cut in the skin, okay, a superficial cut, because our kids keep falling down, right, when they keep playing in the knee, or in this area, in the hands, etc. So what happens? Does it get healed by itself? Yes, we just have to give it a clean environment, and then the skin heals layers by layers, probably within about a week or 2, right? Why does that happen? Because our skin has regenerative capacity and the cells keep multiplying, right? Now imagine that there's a hole in our heart, in my heart, okay? So what do you think? Will that get healed by itself? No, it will get bigger by bigger if it is not treated at the earliest, okay? Because the regenerative capacity of the heart cells is such. Now let's come to the teeth. So I don't know if all of you know, the hardest structure of our body is the enamel, and that's what covers the tooth, okay? Imagine that there's a black dot and there's decay in the enamel. So what do we think? We first think as a parent, when we see a black spot or a brown spot in a child, we think it's okay, it's just a baby teeth, it'll be fine, let me check after a few weeks or months. It will not go. In fact, it will become bigger because the enamel does not have any regenerative capacity at all. So what I would want to say is, the moment you see a brown or black spot, that means it requires immediate attention. Okay, now having said that, let's come to the stages of childhood decay as mild, moderate and severe. Here on my slide, you can see the mild type, right? I have highlighted on a few white spots, which clearly don't look like decay, right? Decay to us is when the tooth looks brown or black. But the first stage of decay is what I am showing you on the slide. The tooth becomes extremely white, okay? So that is called as white spots, and that is the first stage of childhood decay. The second stage is called as moderate, which you can see that there will be spots, but it will not be extensive. But it does require attention, and there the enamel is broken. Like I told you, when the enamel is broken, you need to give attention, you need to get it treated or filled. Okay, the third stage is called as severe. You can see that there is very little bit of tooth structure left, and most of it has been eaten by the decay or the bacteria. There are just the root stumps left, if I must say the right way. Okay, so in this video, we first understood the dentitions, how many teeth does a baby have and what happens to it till the age of 12, and after 12 the permanent teeth come. Then we saw whether the enamel or the teeth have regenerative capacity, and they clearly don't. And the third thing we saw were the stages of childhood decay. Okay, the next video is going to be about the white spots. They have some important speciality which the other stages of childhood decay do not have. So we're going to see that in the next video, and after that we'll try to understand why does this decay happen, can it be completely prevented, if not, what treatment has to be done for which stage. So I'm going to see you in the later videos. Take care. Bye until then.